Hello friends, today we are going to study about nose and paranasal sinuses. Okay, so whenever we take the word nose, the paranasal sinuses are included in it and they are a very important part. So let's first start with the paranasal sinuses. So what are these paranasal sinuses? Okay, so sinuses means empty space around the nose, paranasal. So these are air-filled cavities around the nose and they open inside the nasal cavities. Okay, so how many paranasal sinuses are there? We have 4 pairs, 4 on each side, right? So what are these 4 paranasal sinuses? As you can see, number 1, we have the maxillary sinus, right? So number 1, we have the maxillary sinus. Number 2, we have the frontal sinus. Number 3, we have the ethmoid sinus. And number 4, we have the sphenoid sinus, right? So we have 4 pairs of paranasal sinuses: maxillary, ethmoid, frontal and sphenoid. Let's talk about each one of them one by one, right? So let's start with the maxillary sinus. So this maxillary sinus is in the maxillary bone, right? So we have a pair of maxillary bone, one on each side. So we have in it the maxillary sinus. This is the sinus which is first to develop. First to develop. Embryologically, this is first to develop. Starts developing at 12 weeks. 12 weeks, 3 months of intrauterine life. 3 months of intrauterine life, right? So this is the first to develop. This maxillary sinus, this is the largest paranasal sinus, right? So let's look over here. This maxillary sinus, this is the largest paranasal sinus. Adult volume is 15 ml. Adult volume is 15 ml. Okay, so largest paranasal sinus volume is 15 ml. Okay, so because it is a very big cell, we also call it as maxillary antrum, right? So we also call it as maxillary antrum, also known as antrum of Highmore. So you can also remember it like, you see, it is the largest paranasal sinus, so largest, so high and more. Okay, so antrum of Highmore, largest paranasal sinus. Right, this sinus keeps on developing and reaches adult size by 15 to 18 years of age. So remember, 15 ml is the volume, 15 to 18 years of age, right? So reaches adult size by 15 to 18 years of age. Okay, so now this is the sinus which is first to develop, maxillary sinus. Okay, so now what comes after maxillary sinus? After maxillary sinus comes the ethmoid sinus. After maxillary sinus, we have the ethmoid sinus. So you can see over here, ethmoid is a group of cells. They are small, tiny cells, tiny air cells in the ethmoid sinus, and we divide them into 2 separate groups: anterior ethmoids and posterior ethmoids, right? So ethmoid sinus is divided into 2 groups: anterior ethmoidal cells and posterior ethmoidal cells, right? Okay, so we have the second sinus to develop, that is the ethmoid sinus, and then develops the sphenoid sinus. Okay, so traditionally it has been taught that the sphenoid sinus starts developing around 2 years of age. Okay, sphenoid sinus starts developing around 2 years of age. But at the time of birth, we still have a small sphenoid cavity. Very, very small sphenoid cavity is present at the time of birth, but the main pneumatization, the sphenoid sinus starts around 2 years of age. Okay, now the last to develop is the frontal sinus. It starts developing after 2 years of age. Okay, frontal sinus starts developing after 2 years of age, right? So this is the last to develop. So we have a sequence. Sequence is MES: maxillary, ethmoid, sphenoid, frontal. First to develop is maxillary sinus, last to develop is frontal sinus. So this is the sequence of development: MES, maxillary, ethmoid, sphenoid, frontal. Now look in this diagram. When you look in the diagram, you will see that this sphenoid sinus is quite deep, right? The sphenoid sinus is quite deep, whereas the frontal sinus is just below the skin. So therefore, when we do a plain X-ray, the frontal sinus is very quickly visible, right? So as it is growing, it quickly becomes visible on a plain X-ray, whereas sphenoid sinus takes time to become visible on a plain X-ray. The sphenoid sinus is visible only by the age of 6 to 7 years, whereas frontal sinus, it becomes visible on a plain X-ray by 4 to 5 years of age. Right? So sphenoid sinus is the last to appear on a plain X-ray. Sphenoid sinus is the last to appear on a plain X-ray. Right? Okay. So let's go and do this table. Now when we go and do this table, you see the maxillary sinus starts developing at 12 weeks. It is present at the time of birth. Ethmoid sinus again present at the time of birth. Now sphenoid sinus, I told you, traditional teaching is that the main pneumatization starts around 2 years, but a small sphenoid cavity is present at the time of birth. So yes, it is also present. Okay, what about frontal sinus? So now if we go to the Gray's anatomy language says that the frontal sinus is also present as a small cavity at the time of birth. But this cavity is indistinguishable from anterior ethmoidal cells. This cavity is indistinguishable, right? So that means if somebody asks us a question, which of these sinus is not present at the time of birth, we can safely mark our answer as the frontal sinus, right? So this is the sinus that we can say is not present at the time of birth because it is indistinguishable at that time from the ethmoid cells, right? Okay, and as I told you, the sphenoid sinus is the last to appear on a plain X-ray. It appears by 6 to 7 years of age, whereas frontal sinus appears by 4 to 5 years, right? So this is the last to develop, but the sphenoid is the last to appear on a plain X-ray. Okay, now let's come to the adult size. So when we were discussing the adult size, I told you maxillary sinus, it reaches adult size by 15 to 18 years of age. It reaches adult size by 15 to 18 years of age. Remember, adult volume is 15 ml, reaches adult size by 15 to 18 years. Now, ethmoid is a small group of cells. So we can deduct 3 out of it. We can deduct the 3 out of 15 and we get 12. Small group of cells. All right. So now how to remember sphenoid and frontal? So remember the sequence: maxillary, ethmoid, sphenoid, frontal. So this is the sequence of development. And you see over here, you can take the 15, sphenoid at 15 and frontal at 18. So remember, frontal sinus is the last to reach adult size. Frontal sinus is the last to reach adult size. Right? So we have discussed the paranasal sinuses anatomy a little bit. We will be discussing more. But since we were talking about the X-rays of the paranasal sinuses, so let's go and discuss the X-rays of the paranasal sinuses. Right? Okay. So let's come to the Waters view. Most commonly done X-ray view. Most commonly done X-ray view for the paranasal sinuses. Waters view. Right? So what we do in Waters view? In Waters view, we make a patient stand facing the X-ray plate. So as you can see over here, patient is standing facing the X-ray plate. His nose and chin, they are both touching the X-ray plate. So you can see nose and chin, they are both touching the X-ray plate. Right? Now we give an X-ray beam from behind. We give an X-ray beam from behind and it comes out from the mentum. It comes out from the mentum. This is known as occipito mental view. Occipito mental view. Nose chin position, or occipitomental view. Right? Okay. So what do we see in water's view? What do we see in water's view? I'm sure you can identify the sinus. This over here is the maxillary sinus. Right? So you can identify the maxillary sinus clearly, and you can also identify the frontal sinus. Right? Okay. So you can also identify the orbit over here. Right? So this is the orbit. Right? You can identify the septum. Right? So this is the nasal septum, and you can identify the nasal bone also. Right? So you can identify the nasal bone. Now you see this cell, you see the cell between the orbit and the nasal bone, this over here, it is the ethmoid. It is the ethmoid. Now I have already told you ethmoid is a group of cells divided into two groups, anterior group and posterior group. So what we see over here is anterior ethmoid. Right? So what we see over here is anterior ethmoid cell. All right. So this is the water's view, and if you notice over here, the patient's mouth is closed. The jaw is closed. Okay. So we can identify the maxilla, we can identify the mandible, and we see that the jaw is closed. Right. Suppose I do this water's view with the open mouth. Okay. So I do the water's view with the open mouth. We can also see the sphenoid sinus. Now we can also see the sphenoid sinus. Right? Okay. So you see the patient is standing over here once again facing the X-ray plate. His nose and chin, they are again touching the X-ray plate. Right? His mouth is now open. His mouth is now open. All right. So this is known as water's view with the open mouth, also known as Pier's view. Also known as Pier's view. Right. Okay. So let's go back to the water's view. Which sinuses are best seen in water's view? Which sinuses are best seen in water's view? Or I can put up a question. This water's view is the best view for which sinuses? Best view for which sinuses? Answer is number 1, maxillary. Number 2, anterior ethmoids. Number 1, maxillary. Number 2, anterior ethmoids. Okay, next question. Next question. Which sinus is not visible in water's view? Which sinus is not visible in water's view? Okay, so the answer is posterior ethmoid. Answer is posterior ethmoids. Remember, posterior ethmoids is not visible in water's view with a closed mouth or water's view with an open mouth. All right, so our best answer is posterior ethmoids. Right? If posterior ethmoids is not in the option, then of course we can mark the answer as sphenoid also, but posterior ethmoid is the best answer. Right? Okay, now the next question, what is the best view for frontal sinus? Right? Best view for frontal sinus. So the best view for frontal sinus is Cardwell's view. Best view for frontal sinus is Cardwell's view. What we do in Cardwell's view? In Cardwell's view, again we make the patient stand facing the X-ray plate. So you see over here, patient is standing facing the X-ray plate. Now his nose and forehead, they are touching the X-ray plate. His nose and forehead are touching the X-ray plate. Right? So this is also known as nose-forehead position. You give an X-ray beam from behind. You give an X-ray beam from behind, from the occiput, it comes out from the frontal region. This is also known as occipitofrontal view. This is also known as occipitofrontal view. Right? Okay. So nose, forehead position or occipitofrontal view. Best view for frontal sinus. Right? Okay, so these are plain X-ray views. Water's view, Pier's view, Cardwell's view, these are plain X-ray views. Nowadays, we have better technology than X-ray. So these X-rays are not done these days. Okay, or we can say they are rarely done and they are rarely used for clinical practice. Okay, they are almost obsolete. So remember, these x-rays we have studied for the MCQ answers, but they are rarely done these days. They are not the investigation of choice in any of the paranasal sinus condition.